Welcome to this lecture on access to healthcare. My name is Mark Harris, and I'd like to acknowledge the traditional owners of the land that we're on. I'm on Camaragal land and pay my respects to Aboriginal elders past, present and emerging. This lecture will help you to understand access to healthcare, to identify and describe some barriers to accessing healthcare, and also understand some of the ways in which we can overcome the barriers to healthcare. What is access? Access is the use of health services to achieve better health. It results from both the way in which services are provided and also the ability which consumers or patients have to use the service. This diagram shows how providers and consumers influence how care is used. On the top row, we can see that providers can make services more accessible by making it more approachable. This might be through providing information about the service or by taking the service to people in the community through outreach service. Next, services can improve their accessibility by making the service more acceptable to their consumers or patients. They can do this by improving the extent to which it addresses the values or culture or gender of patients. So, for example, for female patients who prefer to have a female doctor, making sure that the service provides a female doctor at a time when they can use it. Thirdly, they can improve the availability and the extent to which the service accommodates people's needs. This includes the hours of opening of the service, but also can include the extent to which it provides interpreter services for people who don't speak English. So that's an example of accommodation. Next, it can try and make the service more affordable through trying to reduce the costs to the consumer. So what patients, for example, have to pay out of their own pocket. It can also make it more affordable by reducing some of the indirect costs, for example, parking or other costs of transport. And lastly, services can improve their accessibility by making services more appropriate, providing care that's of high quality, but also where patients feel able to engage with the service and that the provider communicates actively with them. On the bottom row, we can see the various abilities which patients or consumers need to have in order to use the service. So and these more or less match the ways in which services can try and make themselves more accessible. So people need to be able to perceive that they need a service. So they need to understand a bit about health, their own health, so that they can identify that they have a need. And when they have a need, they need then to have the ability to seek out the care that they need. So to find the service that they need, the healthcare service that they need. And to reach it, they need to be able to get transport to the service. They need to be able to get into the service if they've got a disability, for example. And they need to be able to pay for it. And lastly, they need to be able to engage with the service. They need to have, for example, the knowledge and confidence to ask questions of their healthcare provider. So we can see in this way, all these factors influence healthcare. So how common is it that people experience problems with accessing healthcare? So this is some information from the Australian Institute of Health and Welfare in 2016 on people 45 years of age and over. And found that about 1 in 4 people reported that there was a time when they felt they needed to see a GP but didn't go. About 1 in 8 reported that there was a time when they felt they needed to see a specialist, a medical specialist, but didn't go. And people with higher needs were more likely not to go than those with lower needs. About half of patients who didn't see a GP when they felt they needed said it's because they couldn't get an appointment. The other kind of problems which people talked about were the cost of services and their availability. And these problems were more common in people in rural areas or people living in low socioeconomic areas, or people who spoke a language other than English were from a culturally and linguistically diverse background. So some of the barriers that people experience may be due to service factors or consumer or the public's factors. So for example, on the service side, the cost of services, particularly in comparison with people's ability to pay, is important. And so, for example, for dental care in Australia, many people forego accessing services because of the cost of those services for dentistry. Waiting time for appointments is an important factor that influences people's ability to access care. And the provision of services in languages other than English, or providing appropriate care that's appropriate for people's cultural or religious background. On the consumer side, not seeing or accepting the need for care due to a lack of knowledge or due to social or cultural factors. So social and cultural beliefs can influence people not to seek care when they really should. And also, patients might not have the ability to arrange an appointment. For example, with a hospital appointment, it can be quite complex to on the telephone to get through to people and to arrange an appointment. And then to get to an appointment can be a problem with transport. And also, engagement can be a problem with people's ability to ask questions or engage with their care provider. So there's really two different kinds of approaches to helping people overcome some of those barriers. So first of all, we can practically provide help. So we can help identify local, language and culturally appropriate services and tell people about that. We can assist them in arranging appointments. We can help them get there. We can go with them to help them to engage with their care provider. Alternatively, we can try and build patients' capacity to do these things themselves. We can do this by explaining where and how to identify appropriate services. We can teach them how to arrange an appointment. We can ask them to help, who can help them with transport. For example, it might be a relative that can help them. And we can suggest or write down some questions that they can ask their provider. In practice, it might be a mix of both of these depending on a particular person and their ability. Thank you for listening to this lecture. There's some resources available. New South Wales ACI Consumer Enablement Guide is available on that link. And there's also a link to Service New South Wales site, which has some information about accessing services. Thank you.